சரி, ஓகே. நான் ஒரு 20 minutes நான் பேசுறேன். Okay. So I was listening. It's comfortable. Yeah. So here I want to. Okay. So, yesterday we had a short session, right? No, related to medical systems and signals. So maybe for another 30 minutes, we will again have a kind of intro to EMG. Okay. So before getting to EMG, okay. So I want to know about this thing. I mean, what do you know about signals? What do you mean by signal? Signal is an information. Then can we tell some? I mean, what else we can infer? It's an information. Then any. Hmm? So it's an information. So let's say, for example, I mean, let's say satellite capturing an image. First image is a signal or what? It's a two-dimensional signal. For example, in medicine, okay, you would have seen X-rays, MRs, right? No, ultrasounds, okay. All are it's a two-dimensional image, but actually it comes under the category of signals, okay. But that is I mean, it's a two-dimensional. I mean, signal means we need not have to have only one dimension, okay. It could be two-dimensional, and we also can have three-dimensional signals. I mean, can you give any example for three-dimensional signals? Sorry, video signals. Great. Then what else? Video signals. Yeah, I mean, let me be bit precise. Can you give some example for video signals? For example, FMR, right? No, cardiac imaging, okay, lung imaging. For example, see those kind of this thing. Okay, we will. I mean, see MR gives information about the structures. Okay, for example, brain. Let's say cardio was heart. Okay, it gives about the structures, information about the heart structures. Okay, and we can also do imaging such that I mean we can also see how the structural deformation happens with respect to time, because see heart, how many times the heart beats per minute? Roughly 72 times, right? No, so 72 times, okay, I mean the heart, that this thing, so it should pump the blood. So that mechanism also we can just get to know from cardiac MRI. So apart from the time, apart from the structural information, if you incorporate time, then become 3D, right? No, so here, by the way, as far as this thing is concerned, we are interested in EMG. I mean, so you can see signal, as you said, it conveys information. By the way, but most of the time, this information what like, I mean, whatever the signal we record, like, the information, most of the time it will be buried. Okay, for example, let's say ECG. Okay, if you record, let's say in this, if you try to record in this room, you may see some sort of noises. Okay, and with the ECG, doctors cannot take any decision. You got it? Then there comes the engineering. Okay, there comes, like, I mean, obviously, like, we have to develop our algorithm, okay, to remove all those noise and other things. Okay, so yeah, so biosignals, again, like, it carries information about the human body. You can see this is the ECG. Okay, see, this is the ECG. You can see that. Okay, I mean, those who are in medical, okay, medical, who are doing medical engineering course, know about this. But, like, I mean, you at least, like, in some point of your this thing life, you might have seen this. Okay, see, this is normal ECG. Okay, and if you see, if I see, I mean, you see, this is an abnormal EEG. Okay, some changes in the pattern. Okay, here basically we have a machine, ECG machine. It records ECG. Okay, see, if doctor sees this image, this signal, doctors say that, like, see, okay, fine, your heart is normal. But if they see this ECG, they suspect some sort of let's say abnormality. Okay, but here, okay, what is important to note is whether the system that records, whether, like, it does its function properly. Okay, for example, see, the heart is functioning properly, but the system, let's say, like, has some sort of malfunction, then the resultant ECG will be abnormal. You got my point. But doctors cannot, like, now, like, after seeing the ECG, doctors should not, like, I mean, treat, like, I mean, considering, like, it has abnormal. So, I mean, what actually I would like to say is, see, as far as medical instrumentation and medical this thing devices are concerned, okay, that the whatever the signal that we get out of this thing, I mean, okay, it has to pass, some sort of, like, validation, calibration, and in fact, like, we have this thing, I mean, in India we have CDS code. Generally, like, whatever the medical device we use mostly, okay, those are all imported from US and Europe. Okay, we have FDA. I mean, those devices should be approved by FDA and this thing. Okay, I mean, this is, I mean, as far as some, I mean, safety concerns, there are some safety standards that has to be met, and safety in the sense both. For example, like, safety to the human being, safety to the data. Okay, so yeah, if you see this thing, yeah, this, you see, this is the first ECG machine, sometime in early 19th century. Okay, you see, I mean, generally that ECG, if you see, this is, sorry, this is in early 19th century. You see, it occupies one full room. Okay, you see, I mean, see, I mean, you can see, he is a patient, and, like, he just kept his hand in one saline solution, and one leg in another solution, right? No, so this is the scenario of 19th century, early 19th century, where, like, the technology were developing. But now, you can see the ECG machine like this. Even, like, watch, we have smart watch. Okay, in our this thing, I mean, like, clinics, I mean, most of the clinics you can see this ECG. So this is a, I mean, like, you can see, like, some I mean, a drastic change in the, okay, technology because of recent advancements. See, I mean, it's not only ECG. We have a lot of I mean, bioelectric signals. I mean, if you see, EEG gives brain activity, ECG gives a heart activity, EMG, what we are going to see, muscle activity, ERG, okay, eye related activity, ECG, EOG, okay, I mean, gives about gives the information about the eye movement. Okay, here most of the time EEG we use it for control purpose. Okay, rehabilitation. In fact, like Professor Ramana was talking about, different this thing. Okay, processes. EEG can be used to control. Okay, and then EMG is basically EMG is another important source. Okay, there are some studies it used EOG as well. For example, I'll tell you, particularly patients with the spinal cord injuries. Okay, cervical spine injuries. Okay, see our we have cervical spine C1 to C7. Okay, generally if there is any injury, okay, happened in this region, most of the time, okay, they lose their hand and the leg functions based on the level of based on the I mean what like based on the injury present at that level, because we have C1 to C7 level. Okay, generally they lost their movements. Okay, they because I mean this injury, because of this injury, nerve, okay, may be damaged. It cannot conduct the information. So they cannot move their this thing. I mean, in a worst case, okay, both upper limb and lower limb will be paralyzed. Okay, for those patients, okay, we cannot use EMG because we don't see any parts below the neck working. Okay, so in that case, either we can go for EOG, sorry, EEG and EOG. EOG is an another one very nice choice, but the drawbacks is we have to place sensor above our eyebrow, okay, and then on both sides of the eyes, okay, left and right eyes. Okay, so EOG would help for those with basically we call them as a tetraplegics or quadriplegics. Okay. So apart from this, biomagnetic signals like NASCOM now, magnetoencephalography. This is another modality that gives information about magnetic field generated by our generated in the brain. Okay, biochemical signals we have. Okay, yeah, bioacoustic, biomechanical signals. Biomechanical signals is nothing but for example, let's say you all would have known about inertial sensors. Okay, IMUs, okay, can be used to this thing. Even if you see, you all would have an app in your in your laptop. Okay, it helps, it will tell how many steps you have walked, like those kind of things. Those generally generated by capturing the mechanics of movement. Okay, bioimpedance, bio-optics, all those things are there. Okay, if you see biosignals as such, okay, you can see you will get information from almost all parts of the body. That's one of the this thing. In fact there are some cons. Okay, for example, from EEG, as I said here in the last yesterday, I mean from EEG we cannot get information about what happens at the deeper regions of the brain. Okay, that's that. But still you can see from biosignals, for example, based on the let's say the location, we will get a complete information about the entire complete information about the let's say complete information about the human body. Okay, starting from, as I said, head to all the way toe. Okay, so yeah, so this is just brief introduction for those who are non-bio, okay, people. Yeah, so brain, uh, brain is one of the complex machine. Okay, one of the most, let's say, complex machine in the world. Okay, brain, it contains about 100 billion neurons. Okay, for example, let's say if you are meeting somebody after 10 years, after 20 years, let's say if you are meeting your friend after 20 years, after 30 years, you can quickly, with no time, you can recollect and you can recollect all the good and bad memories. You got my point. And let's say if you want to, let's say if like you think about the scenario. I mean, now let's say like we are hearing a fire alarm, and all you can run and go out, okay, within few seconds. I mean, you need not have to look at the stairs or ground when you are running. Right now, you can able to do it right now. So all those things, okay. And if you want to write, you can able to write comfortable like now. See, all those things are very small activities, but you can see like I mean, that is integrated with our life. Okay, let me put it in this way. So brain, is responsible for all those activities. Whatever we do, for example, like I'm talking to you guys. See, I mean, like it happens like with no time. Okay, see, brain. I mean, like I'm seeing you guys. So it's a feedback system. My eyes gives information. I mean, my eye gives information to. I mean, let's say like the regions. I mean, in the brain. I mean, the eye takes the information to occipital lobe. I mean, the back side. Okay, this I mean the neurons in the occipital lobe. The back side. I mean, like gives okay information to my frontal lobe. This region. This region is responsible for actuating all my facial muscles. This will tell what I have to talk, and what I should talk and what I should not talk, and this all happens with no time. So brain, like see, if you look at the connections, you think about like we have 100 billion neurons, and each neuron will be connected to at least another thousands of neurons. Think about it. The connections are complex. That's what like people like now like I mean last 20 years they work in brain connectivity. They want to know the connectivity patterns, how the brain I mean the neurons in the brain are connected, and how this connections changes in neurological disorders. For example, stroke. Can I able to predict the stroke well in advance by seeing the connectivity patterns? Okay, if I could say at least like maybe 6 months or 1 year or 5 years or 10 years before, hey, see, you are going to get the stroke. Like I mean, you may be a candidate of stroke like in another few years. Okay, so those kind of research are still like this thing. Okay, in epilepsy, okay, what actually we do, I mean, patients get seizures, fits, okay, uncontrolled movements. We try to see whether like I mean because this again I'm telling, these connections, we brain connections, we categorize into different types. Okay, structural connection is one type of connection. We also have functional type. Okay, functional type in the sense, for example, I'll tell you. Let's say if I'm asking you to do some movement. Okay, let's say if I'm asking you to write a name. Okay, and if you can see when you write a name, okay, I mean I mean some portions in the brain will be active. Okay, it need not have to be structural. I mean it need not have to be a physical connection. Okay, it could be a functional connection. Okay, and this functional connection also changes with time. Okay, so those things are there. So neurons, as I said, like I mean you can see generally like we have this is the head of the neuron. Okay, generally like neuron receives information, okay, at this juncture, okay, and process it and pass this information to the tail. Okay, tail, we call this as a synapses. Okay, so this is dendrites. So we have the different neurons. Okay, neurons responsible for motor activity, motor neuron, sensing neuron. For example, like sensing, like for example, like I mean the moment temperature changes, weather changes. Okay, I mean we could able to feel it, right? No, and if so, I mean those kind of sense. I mean those kind of sensings. Okay, we could able to feel. Okay, because of sensory neurons. Okay, and for example, like if we when we walk, okay, like unknowingly, if we, let's say we are keeping our, like, I mean, if we're keeping our foot on, like, let's say water, how do we, you need not have to see the water, but you will come to know. Okay, happens because of this thing, I mean, sensory neurons. We have interneurons. Okay, the neurons, okay, that stand somewhere between this motor and sensory neuron. Okay, so those are three different types of neurons we have. Yeah, so as I said, like, no, I mean, like, uh, a single neuron, okay, will be connected to, I mean, as I said, like, the thousands of neurons. We will again say postsynaptic, presynaptic, and so on. Okay, so yeah, so this why, I mean, neuron generally connected to muscles. Okay, as I said, we have 600 plus muscles connected to muscles. So basically, I mean, brain composed of like, I mean, some, like, I mean, billions of neurons. Each, I mean, if you see, these neurons will be connected to about 640 muscles. Okay, and if you look at the muscle again, like, we have different these things. Okay, so muscles, we have three different types. Cardiac muscle, okay, we are not going to discuss. Okay, smooth muscle. Okay, again, for example, cardiac muscle, all we know. Smooth muscles, like, what are those smooth muscles? For example, the generally, like, if you see, yeah, I mean, a liver, okay, I mean, the tissue, okay, liver tissue, pancreas, intestines are all, like, considered as smooth muscles. Okay, skeletal muscles is what we are interested. Okay, skeletal muscles, if you see, skeletal muscles are muscles. Okay, generally, like, we, whenever we say muscle, whenever we say EMG, okay, that will be only associated with skeletal muscles. Okay, skeletal muscles. Okay, so as I said, like, we have more than 600 muscles. So the primary function of the muscle is this body movement. Okay, movement. Okay, if muscles are not moving, for example, you might have seen patients with a stroke. Okay, one side of their face may not work, facial muscles may not work. Okay, one side will be working, so you can see some, one side, like, will be static, another side will, it will be pulling, so it looks like some sort of, like, abnormal this thing. Okay, posture. Okay, and maintenance of posture, for example, like, see, you all sitting for a long day, I mean, for example, like, you can sit for the entire day. Okay, you need not have to do work. Okay, see, you can sit for a long time, I mean, for a long time, entire day, need not have to work. Sorry, you need not have to work in the sense, I mean to this thing, physical activity. Okay, muscles are responsible. Still, like, some energy is exhausted. Okay, and communication, like, speech, like, facial muscles. So yeah, these are all, like, three, I mean, important those things. That's what, for example, if you see sports in, I mean, nowadays in sports, particularly, like, I mean, if you see, like, sprinters means fast runners. Okay, I mean, this thing, marathon. Okay, I mean, that are slow runners. Okay, so if we want to measure the performance, okay, because, like, when we measure the performance, then only we will know, like, whether, I mean, somebody is doing good or not. If they are not doing good, like, then, like, this could be given to, this information could be given to trainers. Okay, to just know, maybe, like, to design, let's say person specific, let's say, like, protocol. Okay, like that, like, to improve their sporting performance. So I mean, that's what, like, EMG can also be used. Okay, now, like, EMG along with inertial sensors and force sensors can also be used to measure the sport. I mean, measure the performance in professional athletes. Okay, so, and if you look at the skeletal muscle, like, these are the properties: excitability, contractibility, extensibility, elasticity. For example, see, we cannot control our heart, but you can have complete, you can take the complete control of your muscles. Okay, you can train, for example, like, those who are regular to gym. Okay, I mean, you guys know very well. Okay, you can have a complete control on your this thing, but you cannot control I mean, heart. I mean, in the sense, like, I'm talking in terms of, like, excitability. Okay, contracted this thing, contracted okay, extensibility, elasticity. And another thing is, see, this elasticity is another one important this thing. Okay, see, for example, in sports, let's say for fast runners, okay, let's say 100 meter this thing, okay, see, the moment the competition is over, after some time, okay, they will be back to this their original form. So that's because of elasticity. Okay, muscle, okay, they give they give the maximum force in a minimum time, then after some time, like they'll come back to the same. So that's another one, like very nice property of muscle skeletal muscle. Okay, so again, like we discussed about brain, neurons right now. Similarly, muscle, like what is the fundamental unit of muscle? If you ask that question, then similarly, like see, in brain, like we have neurons. Here in muscle we have motor units. Okay, it's a basically this muscles generates force. For example, even like see, you are sitting right now, you exert some force on the chair. Okay, and this is actually generated and regulated by muscular system. Okay, so the smallest unit in muscle is like motor unit, and generally, like let's say if you take a piece of muscle and just if you cut out, and if you look at in a microscope, like it appears something like this. Okay, see, this is connected to bone. So whenever it contracts, so movement happens. Some force is generated. Due to this force, movement happens. So generally in rehabilitation, okay, for example, okay, muscles will be there, it will be contracting, but the force may not be this thing, okay, because of amputations. Okay, so that part, like what actually we will do, we will collect the signals that are generated due to this muscle contraction, and we will use those signals for like producing that force, or like restoring the movement. Okay, so and by the way, like let me this thing. Yeah, if you look at the this thing, for example, like here number of motor units. See, our thigh muscles, like it's thigh muscles, like if you see the number of motor units in our thigh muscle, it will be large in number, and there are this thing, muscles with very few motor units. For example, the muscles of our this thing, muscles that is responsible for our that this thing, lifting our this thing, eyebrows, raising our eyebrows. Okay, this very small muscle, like you can see only very few motor units. Similarly, like in our hand, okay, see, lot of muscles are there. Lot of muscles are there. Okay, we have intrinsic and extrinsic muscles. Very small muscles. Okay, like if you see for an activity, okay, I mean, I mean, few muscles will be involved. Another few muscles will not be involved. So again, accordingly, EMG changes. Okay, and by the way, this let's say this few muscles are recruited right now. This also sometimes changes with time. For an activity, let's say if you're doing an activity, for the same activity, you can see difference in the let's say muscle let's say activation, and this also results in the change. This also affects the EMG. Okay, that there comes like we just know the processing. Okay, so yeah, we will see that. Different types of muscle fibers, and by the way, like these are all, I think yeah, I'll explain this as well. See, generally, by the way, muscles, if you see, muscles are made up of motor units. Great. We have two different types of muscles. Okay, we call it a slow twitch, fast twitch. Okay, slow twitch means the muscles that are responsible for generating low force, and those muscles are not will not be fatigued fast. Okay, for example, let's say when we walk, in layman time, okay, you could able to walk for a long time. Okay, you will not get like what, like this thing, let's say leg pain so fast. But if you run, okay, maybe in 15-20 minutes, based on your endurance, you will be fatigued. So in the first case, basically you are what actually, I mean, we are walking. So generally we need only low force. So only this thing, I mean, the muscles responsible for that this thing, I mean, low force only activated. Okay. Whereas in the running, okay, another category of muscle, okay, fast twitch, basically fast twitch muscles generates large force, but in a short time. Okay, and it will be fatigued. So basically in this thing, I mean, for sprint in sprinters, if you see, okay, most of the time this fast twitch muscles will be activated. Then only they can have high force in a short time, and they can complete that task. Okay, so those again, like in this thing, I mean, athletes training. Okay, generally, like this kind of EMG can also be used to what, like measure the performance, and it gives I mean, with that EMG the coach can decide which muscle, okay, which muscle has to be trained, which muscle has improvement. Those kind of information also can be, like what, like this thing, I mean, inferred. Okay, so that's this thing, slow twitch and fast twitch muscle fibers. Yeah, again, like little bit physiology, I'm skipping this. So I mean, this is what this is what, like I was telling. As I said, like brain, okay, it's a masterpiece of this thing, okay, of our human body. Is everything, okay. And this I mean, you see neurons, okay, see this will be connected to muscle, okay, through spinal cord. We have spinal cords, okay, we have this is cervical spine, okay. I mean, we also discussed about tetraplegics, right? No, cervical spine, okay. So I mean, if you see uh, I mean, this is again, this is spine, this is muscle. Generally, like for example, let's say in this case, okay. See, if you I mean, let's say, like if you, let's say, let's say if I want to lift this, okay, if I want to lift this, see, what information I have is, like I have only the image of this mic. I really don't have any idea about the force that is required to lift this object. Okay, but I could able to lift it without any drift, without any complexity. What happens? You see, my eye, okay, I mean, gives the pictorial information, and the moment I touch, okay, we also discussed about sensory nerves right now. So the moment I touch, the sensory nerves, okay, gives some sort of information, the I mean, yeah, related to this object. Okay, so based on this two activity, if you see, it passed to our this thing, I mean, the frontal lobe. Okay, now this frontal lobe brain, okay, I mean, recruits in the sense, let's say, fires, okay, the motor unit that is required to complete this task without any difficulty. So this is what happening. You can see this, sir, and you see, sorry, you see, sorry, see, this is again, like see, glass. See, this is like different this thing. I mean, see, in all three tasks, okay, the intention is to hold glass, but it needs different force. But we could able to do it without any complexity. Okay, so you got my point. So when we in the rehabilitation, for example, like gripping, okay, gripping activity, pinch grip or power grip, whatever. So generally that is missing. For example, if somebody having a wrist disarticulation, okay, I mean, they don't have the hand, okay, till year they will not have this, okay. Then, like I mean, this feature will be missing, and like generally, like the engineers, like will do all those things to just restore those movements with EMG, because EMG generates force. I mean, sorry, muscle generates force to lift this object. Okay, and again, object size important, shape important, and what, like the properties important, the weight important, right? For example, like let's say tea, I mean, like tea, I mean, hot tea you are holding, and let's say, I mean, some soft drinks holding. See, I mean, hot tea, again, like that's this thing. Okay, you need more precise this thing. soft tea, I mean soft drinks, it's fine, like still it's okay. Okay, so okay, maybe I'll, what's the time? Okay, yeah, I'll stop here. Maybe we'll continue from here. Okay, and then on tomorrow. Okay, we'll see that. So maybe like, I mean, what I'm planning to do is I'll explain about the generation of EMG, followed by how EMG can be used for upper limb processes and lower limb process. Okay, we will see that, and we also have this thing. I mean, we have EMG system. Okay, we also show like how EMG can be recorded. Where do we place the electrodes? And another one important this thing is see, we have standards for EEG. EEG is a clinical tool. I said right, no, EEG is a clinical tool. You can see in the hospitals. ECG also clinical tool. See, we have a standard this thing. I mean, protocol for the electrode placement. But as far as EMG is concerned, we don't have any standards. Yes, we have standards, but again, like do we have standards for all the 600 plus muscles? Then the answer is no. We don't have standards. Particularly, for example, see this thing tetraplegics, for those who cannot, whose let's say both their this thing hands and legs are not working. Facial muscles could be an, I mean, facial muscle signals recorded from facial muscle can be used. But again, facial muscles, like where do we place the electrodes? You got my point? Because like these signals are noisy. See, it should be reproducible. Whatever the signal you use, it should be reproducible. Then only I can use it for a control purpose. If it is not reproducible, then like I mean, what is the use of it? So again, another the six standards. We'll discuss all those things maybe in the next session. Thank you very much. Sorry. ஐயோ நான் எங்க வந்துட்டேனா